If you're feeling nasally, well, don't you worry about it. Or you've got a slight fever, cases of flu are on the rise in South Africa. That means you're not alone. The National Institute for Communicable Diseases wants to remind people that it is never too late to get vaccinated. Although most people will present mild illnesses, influenza can cause severe illness in high-risk individuals. For more on this, we're joined by the NICD's Professor Cheryl Cohen. Prof, thank you very much for your time this afternoon. Perhaps let's put it into context and go a little bit back when we saw COVID-19, or we experienced that on our shores in 2020. So almost 3 years later, we're seeing a rise in the cases of influenza. It was reported back when we were in the grips of COVID-19 that cases of flu were down. How should we understand this movement?
Yeah, so thanks very much. And as you say, we really are seeing a lot of flu around now. It's the flu season, and in fact, the flu circulation is at a high level. And you're right. During COVID, the circulation of flu was very low, and so this may well reflect influenza returning to levels that we used to see before COVID, but also it could a contributing factor to the high levels we're seeing could in part be the fact that we have had relatively low levels of circulation for the last few years, and so there may be a bit of an immunity gap in terms of people not having, or some people not having seen flu for the last few years. So I think there could be a relationship, but absolutely this is kind of what we used to see before COVID, and on the high side is what we're seeing right now.
Sure. Is there any evidence to suggest that non-pharmaceutical interventions like wearing of a mask, good hygiene, etc., could have contributed to the low levels we saw almost 3 years ago as compared to now?
Yeah, absolutely. I think most people would agree that in fact, the reason why we saw so little flu during COVID was because those interventions work, and they work really well for flu, perhaps even better than they do for COVID. And in fact, this had been a controversial area in the field of flu for many, many years. The opinions were divided. But I think following the COVID pandemic and the dramatic reductions that we saw when people, stopped going to school and wore masks and did hand washing and social distance, really proved that in fact, you can have a huge impact on influenza. And I think, of course, that's an important point, because we've all learned really how to protect ourselves against respiratory viruses, and so those measures are still just as relevant for influenza as they were for COVID.
Sure. Let's take a look at the increase in case numbers. I believe we've got something that we can show our viewers in terms of a graphic, the epidemiologic week. What are we seeing here essentially?
Well, so we have a surveillance system that we run by the National Institute for Communicable Diseases, where in different provinces throughout the country, we monitor the levels of flu all the time. And this program is really long-standing. More than 10 years we've been doing this. And so based on this information, we really can set thresholds to work out, how much flu we expect to see in a normal year, and what is high and what is high. And so really what we're seeing right now is that flu is at a high level based on what we've seen in previous seasons, and it's increasing. So we expect flu levels to increase maybe for the next week or two as we see in the season.
Who are high-risk people?
So I think that's really important, because we were talking about how you can protect yourself from the flu, and the people who really need to make an effort to protect themselves are those people at increased risk of getting severe disease if they catch flu. And those are really elderly people, so the older you get, very similar to COVID, the more risk you have of ending up in hospital or even dying. Also underlying disease like heart disease, lung disease, people living with HIV, tuberculosis, all of those conditions make you at risk. And then pregnancy, particularly pregnant women are another risk group particular to flu, who can get very severely ill if they catch flu. So those people in those risk groups really should consider to perhaps wear a mask, don't go to gatherings, and then also to remember that there is a vaccine against influenza, and while it is a bit late, the best time to get the vaccine is before the season. You can still get the vaccine, and it will hopefully protect you. And we do expect to see flu circulating for quite a number of weeks. Normally our season would go on for at least a month perhaps even longer. And so vaccination can still offer some benefit, particularly to those people in the groups at risk of the most severe disease.
So, Prof, you've got two types of influenza viruses, but anyone who has caught the flu this year will tell you that it is so punishing that you're not sure when it's COVID-19 or when it's just the common flu. And so what do you look out for?
Yeah, so I mean, you're absolutely right. My daughter had flu this year, and we tested her, and she was, I knew even before we did the test it was flu because she was really sick. You know, normal colds and flu, can be a bit mild. You can still go to work, but I mean, my daughter had classic flu. You know, the very sudden onset is characteristic. You wake up fine, and then you just feel like a bus has hit you. Terrible. And then very characteristically, it's a full body illness, right? You have body pains, fever is very common, and commonly cough as well. So I think generally the flu, when you have proper influenza with the influenza virus, not the other cold and flu viruses, it is a more severe illness. And classically, it really affects your whole body. That it's not only that you know you must stay home from work not to make other people sick, but you also really feel like you can't get out of bed. And many people have commented, I agree with you, that, you know, COVID is really bad, but influenza is also, it really is a severe disease and, of course, can go on in people at risk to you know, you could end up in hospital or with very severe illness.
You know, Prof, and that's just it, right? Like the point that you make of going to work when you've picked up a virus, as I cover my head in shame. How important is it that those messages that we heard during COVID-19, that you protect your colleagues or you protect the people around you and take the necessary precaution not to spread it? Maybe we can even go back in terms of how it is spread.
Yeah, so I think flu is spread really the same way as COVID. All these respiratory viruses, when we cough and we sneeze, the virus is in the little droplets that go out, and if they can land on other people, they can also end up on surfaces, and you touch the surfaces, and so it's the same really way of being transmitted. And so all of those measures are the key. So washing your hands, I mean, is really, really important. And then also to prevent spread to others, the cough hygiene and coughing into your elbow is very important. Masks can help as well. And then avoiding gatherings, particularly indoors, being outdoors, hugely decreases the risk of transmission. And then, as you mentioned, really if you are coughing and sneezing in particular and you're symptomatic, really to stay home to prevent spread to others. And also because there's a lot of evidence, in fact, that if you do have flu and you overexert yourself, you know, that can put you at risk of going on to more severe disease. So it's also important, you know, the best way to have a short episode of flu is really to stay home for a few days until you feel better. Speaking
of the best way to have a short episode, some people are just anti-antibiotics. And so in terms of maybe homeopathic remedies that people can potentially just take up.
So I think what's really important to note is that actually influenza is a virus, and so we wouldn't be recommending antibiotics. Antibiotics mostly work against bacteria. So for most cases of the flu, in fact, you're totally right, you don't need antibiotics, and we don't want, you know, people to be over-prescribing antibiotics, because antibiotics should really only be used when indicated. So you really should stay home, and then, you know, keeping warm. Some people say ginger and lemon. There's not really evidence for those, but certainly they make you feel better, and can sort of clear out your sinuses. And then it really is only, you know, if the flu isn't resolving, you know, normal flu should take a couple of days, not more than a week. But if it's not getting better and it's getting worse, and maybe you have a very sore ear or sinus or something else, bad throat, that can indicate that you've in fact got now another infection, a bacterial infection, on top of the flu, because your body's been made weak by the flu, and that you should then really go and see a medical practitioner, and you may need antibiotics. But for flu itself, absolutely, we don't recommend antibiotics. It's really bed rest, stay at home, keep yourself warm, and let it pass.
Sure. Prof, you mentioned your daughter, and so I do wonder for little ones, right? So especially those who go to creche, a lot of parents have a headache, not flu-related, but because their little ones are picking up viruses, including that hand, foot, and mouth virus that's currently doing the rounds. And so what should parents be aware of, especially when you speak of not over-medicating?
Yeah, so that's a really, really difficult issue, and absolutely the toddler age is the most difficult age for controlling respiratory viruses, and you know, you ask any parent, I mean, the parents are getting sick all the time because their children are bringing home all of these viruses, and it's because of how the disease is spread, right? It's coughs and sneezes, and that age they're very keen to hug and kiss, and they don't practice good hygiene. And it is difficult to know what to do in that age group. I think what's important is if it's not too severe, absolutely not to give antibiotics, and really rather let the child sit it out unless there are signs and symptoms that your doctor's worried about. And then it's difficult. You can't keep them home all the time. Sometimes they have runny nose all the time, and you always at this time of year know that the other children at school might have viruses. So it is a difficult thing. I think it is important to be responsible. That if your child has an acute illness and they've now got sick, best to keep them home until they feel better. And the good thing is they do grow out of it, and when they're older, it's a lot less of a problem.
Sure. Professor Cheryl Cohen is with the National Institute for Communicable Diseases. Thank you very much, Prof, for your time this afternoon.